pregnancies are common. In fact, around 50% of pregnancies in Australia are not planned. Everyone has the right to make their own decisions regarding their sexual and reproductive health. You should never feel pressured or forced to do something you do not want to do, even if there is pressure from a loved one, a friend, or a health professional. Your body, your decision. If you live in Victoria and have an unplanned pregnancy, you can choose to continue the pregnancy and provide care for the baby, continue the pregnancy and choose alternative care arrangements, or end the pregnancy by having an abortion. Within Australia, abortion is legal, safe, and a common medical procedure used to end a pregnancy. In Victoria, you can have an abortion up to 24 weeks of pregnancy, and in certain situations beyond this. If you decide to have an abortion, you will need to first confirm your pregnancy. You can do this by booking an appointment with your doctor or women's health nurse. If you're not sure if your healthcare professional will be supportive about your decision to have an abortion, ask to see a pro-choice doctor or nurse when you make your appointment. The next step is to determine a suitable abortion method. If you are under 9 weeks of pregnancy, you can choose to either have a medical or surgical abortion. A medical abortion is a safe, non-surgical method where medication is taken to complete the abortion. It can be performed in the privacy of the home. Medical abortion is available through some doctors or nurse practitioners or via a telehealth phone service. If you are over 9 weeks pregnant, you will need to have a surgical abortion. Surgical abortion is a safe and simple procedure performed in a hospital or day procedure centre under local anaesthetic. You will need to find an abortion service. In rural and regional areas like the Loddon Mallee, it can be difficult to find information about your options. You may also be worried about confidentiality and personally knowing the staff or practitioners. We recommend contacting 1-800-MY-OPTIONS to find an appropriate provider located near you. Interpreter services are available. Your doctor may also be able to recommend an abortion service for you to access. Please be assured that all your health information will be kept confidential. Please note that abortions are time sensitive and may be more difficult and expensive to access the longer your pregnancy progresses. Costs can vary depending on the type of abortion, the clinic you attend, the number of weeks pregnant you are, whether you have a healthcare or Medicare card, and whether you have private health insurance. It is best to talk to the clinic providing the service directly to ask about costs. You will usually need at least a couple of days to have the abortion, rest and recover. You may like to consider having someone with you during the time of your abortion, organising time off work or daily duties. If you have young children, consider getting some help with childcare. If you are having a surgical abortion, you will need someone to take you home from the hospital or clinic. You should be able to return to your normal activities within a couple of days after an abortion. If you are worried about anything, you should contact the service provider. If you are feeling distressed, consider speaking to your doctor or counsellor. If you are pregnant and are feeling distressed about your options, you can speak to a pregnancy choices counsellor by calling 1-800-MY-OPTIONS. You can find more information about abortion services listed in this video and other recommended resources in the video description.